My background in physical medicine is very functionally oriented, and so I'm always trying to figure out what the person needs to be able to do or wants to be able to do that they can't, and why, and how can we impact that. I like it when someone feels better, and people can be very grateful if you can help them with something that is life-altering, and that's the biggest satisfaction. My name is Dr. Paul Smucker. I'm a pain management specialist. I'm actually dual board certified in physical medicine and rehabilitation, as well as pain medicine. I actually completed medical school and then took up with working at a hospital, and my real interest there was taking care of outpatients, so-called physical medicine, people who had neck and back problems. And within that realm, I became more interested in the outpatient care, and then my focus gradually became more and more into pain management and spine care. My main focus is taking care of neck and back issues, and that involves sometimes various injections, other testing procedures, a lot of listening and trying to figure out what's going on with a person. I chose my area of medicine because it's an interesting blend of neurology and orthopedics. There's a lot of new techniques and innovation always coming on with the care of patients in pain, and there's a big need for it, never-ending supply, and I find that I can help a lot of people.